understand that the following information will be gathered and utilized for educational purposes by an Indiana Wesleyan University student. I give my permission for this information gathering and physical assessment to be filmed and posted for access by faculty and students at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable.
Hi, Mr. Smith. My name is Jen. I'm one of the nurses here in the clinic. I'm going to ask you a number of questions about your symptoms and your history. I'm also going to get your vital signs and listen to your lungs, okay? First, I want to get your temperature. Okay, it's 98.9. That's pretty good.
Thank you, Jen. I appreciate it. I just want to be able to breathe. Will the doctor be able to give me any medications so this will go away? I'm just so tired.
Well, I can see how difficult it is for you to breathe right now. First, we need to figure out what's going wrong with you. Let's get started so we can get the doctor in here as soon as possible. This will tell me what your oxygen level is in your blood. Let me take it. Tell me about your breathing. How long have you felt this short of breath?
It's been on and off for about a year now, about when I started to have this nasty cough all the time.
Okay. Your oxygen saturation is about 82%. I would really like for it to be above 90. So why don't we put a little bit of oxygen on for right now just to help you breathe a little bit better. I'm going to take a listen to your lungs, okay? I do hear some wheezing in your lungs.
I just thought I had got allergies at first, and I would take my Zyrtec or generic allergy or cough medicine for all my for what I thought was allergies. Here lately, though, I thought I even had asthma, or I'm just getting old because I just get tired from even walking out to the mailbox to get the mail. Now, even eating dinner takes a lot out of me.
So you haven't felt good for a long time then. And eating dinner, walking to the mailbox, that's hard? Have you noticed it's harder to breathe after you've been exerting yourself?
Yep, I just can't do what I used to do.
Okay, well your blood pressure is 145/75 and your pulse is a little bit higher too, it's 110. It seems to be coming down a little bit. I think you're not quite having the difficulty like what you had before whenever you didn't have the oxygen on when you first came in. You're still breathing about 30 times a minute. Are you feeling any anxiety?
It was real hard to breathe a minute ago, but since you put the oxygen tube on me, it's easing off.
What about sleeping? Have any of your sleep habits changed?
Well, I've noticed that I can sleep better when I'm sitting in the recliner. Laying down is just not comfortable for me anymore.
Okay, so your doctor, your previous doctor, he hasn't ever prescribed oxygen for you?
No, he just told me to do what was comfortable to let my body rest and to breathe a little bit better.
Okay, so getting to this cough, are you coughing anything up? How much? What does it look like? Do you see any blood in it?
No, I haven't noticed any blood in it, but it's really thick. A lot of times I can feel it, but can't cough anything up because it's so thick. Usually the stuff I cough up has a yellow tint. It just looks nasty, like it's thick and yellow.
Okay. Have any of the medications that you've taken, have they helped, or have you had a fever?
No and no.
Okay. You mentioned earlier that you thought that you had asthma. Do you have a history of asthma or allergies? Were you diagnosed at one point, or any other respiratory illnesses?
I don't have any history except for every now and then I get bronchitis, like real bad. My old doctor told me that I needed to quit smoking, so I did. I took up running in the Army, so I like to think of myself as pretty healthy. But I had to stop running about 10 months ago because it was just getting to be too hard and I just couldn't do it. I just couldn't even get a half mile in.
Alright, so you used to smoke cigarettes. How long ago did you quit?
It's been about 4 years now. I don't even like the smell of cigarettes anymore.
How much did you smoke? And how much?
Let's see.
Or how long?
I started when I was about 18 years old, when I first enlisted. So I guess it was about 32 years ago. And I only smoked a pack a day for my last 10 smoking years. And then I retired from the Army. Now, I know that sounds bad, but 22 years in the Army, I smoked 2 packs a day. I mean, the Gulf War, it damaged a lot of us. The Army there was horrible. Smoking cigarettes was a good alternative.
Okay. So it sounds like you could have been exposed to some pollutants in the air too. Were you around when the oil fields were burning?
Sure was. Longest 12 months of my life.
Well, thank you for your service, sir. It's very unfortunate what you had to go through. That air quality may have had some impact on your current lung issues. Now, to help me out with your smoking history, in the medical field, we have a formula to help us figure out what effects the cigarettes could have on your body. With your smoking history, it's the same as smoking a pack of cigarettes a day for 54 years.
Oh my goodness, so it's like I started smoking when I was a baby? I'm only 54 years old, and you're telling me I've smoked for 54 years?
Yes, sir. You've already taken the first step by quitting. That must have been very hard.
Well, one day I just kind of realized it was due to my buddies, and I didn't want to be like that. Now, it looks like it may be too late. In my retired military community, we don't like to admit we're sick. Then when we get sick, it seems like we should have gone to the doctors years ago.
Well, we don't know anything for sure yet, but the cigarettes have definitely hurt your lungs. But we'll run some tests to see to what extent. I have a few more questions for you, though. Does anyone in your family have a history of lung disease?
My dad has COPD. He's on an oxygen tank, and he has to carry it with him everywhere he goes. It's been about 15 years that he's had the thing. One of my brothers has asthma when he was a little one. Doc said that he grew out of it. My dad was a smoker too, but Mom made him quit. And then especially when my brother, Blake, got asthma. He was diagnosed with asthma. But yeah, that's all I can think of.
Okay. Well, with not being able to run like you used to and the other life-changing situations, has this affected you emotionally? Have you noticed any signs of depression since you've been feeling ill?
You know, I've been a little down because I haven't been able to run anymore. I used to be very active, and that has all changed here. Even going to church is a chore sometimes. I talked to the priest, and he's actually the one that suggested I come to the doctor to put my mind at ease.
Well, Mr. Smith, I'm really glad that he talked you into it. Noticing the ashen color of your skin, and I see a little bit of clumping has started to happen on your fingernails. It's where your fingernails start to puff out a little bit. These are all signs of COPD. So if this is in fact, what you have, we want to make sure to get you in and get you tested and get the treatment that you need that's necessary.